a reminder, we really have to start talking about our health, because it really is, I mean, what do we have if we don't have it? I like to think of health as an equalizer. You can be the richest person or the most powerful person on earth, and when you get sick, you can be in the bed right next to someone who has nothing, and you have the same ailment. So we can't run away from it. We walk around in these bodies 24 hours a day, taking them for granted. So again, I'm so happy that we get a chance to have this conversation, just to remind you. So on that note, let's switch to prevention. You all have already talked about a lot of the things we can do to prevent cancer, to prevent colon cancer. And one of the things that's so hard, I mean, my parents grew up in Mississippi. And I grew up eating a lot of stuff a lot of black folks eat. I can't eat like that anymore, because I feel like it's my responsibility, if I'm going to talk to people about health and wellness, that I also have to practice what I preach. And so I made some changes, but it's been a long time coming. It's very difficult. So I want to talk a little bit about that. So you mentioned food, you mentioned fiber. We already talked about smoking as a risk factor. We won't harp on that today. Family history is something you can't change. We didn't talk about exercise. So between what you eat and how much you move or how much activity you have, not only does that impact your colon cancer risk, that impacts almost every condition I can think of, with the exception of infectious diseases that are transmitted, through air and things like that, infections. But when we talk about heart disease, cancer, kidney disease, it's really about what we're putting in our mouths and how much we're moving. So let's talk about how difficult that is, because I know I don't need to stand up here and talk to you about good food and bad food, unless you want to. I mean, we can talk about it.
We know.
But I think there's been enough information out there, and I'm not saying you, because I'm not someone who believes you should eliminate things you love. I think it really is about moderation. But if you don't combine that with some activity, that is a setup for disease and unwellness. So let's talk about food. So who said food was the biggest risk factor? A few of you.
I just said eat oatmeal.
You said eat oatmeal. A lot of people don't like oatmeal.
No.
Who likes oatmeal?
Love it.
Oh wow, you guys are unusual. Why is oatmeal good for you?
It has a lot of fiber.
Okay, back to fiber. So what is fiber doing?
Moving stuff around.
Fiber is helping. So the one of the things they look for when you get your colonoscopy is how much movement is happening and if it's normal. So there's a fancy term for movement in the gut. It's called peristalsis. And all that means is waves. So constantly your small intestine and your large intestine, they're moving because there are nerves throughout your small and large intestine, and they are regulating how much and how the movement happens. And so when you eat things that are full of fiber, it helps push things through. So that's important, because you don't want waste sitting in your colon. Because when waste sits in the colon, it emits toxins. And it also causes inflammation. And when you peel back the layers of what's causing most diseases, it's because things are inflamed in the body. So I want you to understand, when you say we need to eat fiber, there's a reason behind why you need to eat fiber. It's to help keep things moving. And that is what keeps your tissues inside the colon and the small intestine. Keeps it healthy because it's not stagnant. Maybe you've heard of people who have diabetes or they have nerve conditions and they need to take medications to keep things moving. It's because the nerves are damaged by diabetes and it slows down that peristalsis, so that waving motion in the colon. Yes, ma'am?
What other foods keep the bowels moving?
I think the biggest thing you can do to keep the movement the way it should be is activity. So have you ever had really intense exercise, whether it was walking up a flight of stairs or going for a walk in the morning and you have to come back in the house and have a bowel movement? That's why, because you are stimulating the movement. And that's one of the greatest things you can do for a healthy colon, is to incorporate some sort of movement and exercise. Even different kinds of stretches and moving your body in certain ways. If you're not someone who likes to walk or run or ride a bicycle or climb a few stairs, trying to figure out how to improve the amount of movement you have with your body generally will help your colon. What are other foods besides oatmeal?
Green, like leafy vegetables.
Beans, leafy vegetables. Do you have a comment in the back?
Oh, well, I was gonna say, as far as foods are concerned, you could try and use, a probiotic, which nourishes the, gut flora and keeps
What's
the
that?
movement in your intestines also. So if you're,
Yeah, so there are some areas of controversy around what people should eat and what holistic medicines are good for you versus not. I tend not to comment on those things because they're very controversial, and I think the body was designed, it's immaculately designed. And the truth is, your body was designed to cleanse itself. But we don't do the things that are needed to cleanse the body, and one of them is perspiration, exercising. What are other ways the body cleanses itself? So clearly, we've talked about the colon, so pooping, having bowel movements, that is one way the body cleanses itself. How else?
By urinating?
Urinating, all that is the body cleansing itself. What else?
How about sweating?
Sweating, it's a good one. When you perspire, toxins, waste, they're coming out through your pores. You ever sat next to somebody who eats a lot of garlic?
Yes.
That's what's happening. All that stuff is being broken down and it's coming out through the skin. What's another way? This is a little tricky. Breathing. Because you've heard of CO2, carbon dioxide? Your body, when your body is functioning the way it's supposed to, it's constantly making carbon dioxide. And the way to get rid of it is we breathe it out. And so sometimes you might find yourself, that is a response that happens naturally when the body recognizes that you need to take a bigger breath to get some of that extra waste out. So it's actually a good thing to sigh. Because I sigh so much now, people are always asking me, what's wrong? There's nothing wrong, it actually feels good. Like, do it right now, just feels good, right? So try to incorporate that in your day. Not only is it eliminating waste, but it also helps to center you. It also helps to relax you a little bit. It's a way to combat anxiety. So all of these things are naturally built in for us because that's the way we were designed. So I'm sidestepping your comment about probiotics, and we can have an offline conversation about that, but I really don't feel comfortable addressing it here. If you want to read about probiotics, but someone said, what is that? Probiotics are basically bacteria, because the gut is filled with millions and millions and millions of bacteria. And we have bacteria all over our skin. We have them all over inside and outside the body. And when the germ combination inside the colon gets a little bit messed up, either because we're not moving our bowels regularly, or we're not eating the right food combinations, or if there's some sickness here, some sort of colitis or inflammation in the colon, the combination of bacteria in the gut creates a problem. And so one of the solutions for that is to give it the kind of bacteria it needs. And so probiotics are a way of providing new germs into the body. There's an infectious disease, you all may have heard of it, C. diff. Have you heard of that? This is an infectious disease that causes profuse diarrhea. And the problem with having diarrhea that's uncontrolled is you become malnourished, because your body absorbs a lot of nutrients. When you eat food and it gets broken down in the colon, those nutrients are used for fuel and to keep your body and your organs going. If the infection becomes overwhelming, that doesn't happen. And so if someone's getting diarrhea, that's where the malnourishment comes in. You can also be dehydrated, very weak, start to lose weight. And the treatment now for that is what we call a fecal transplantation. And it is just what it sounds like.
Wow.
They're basically taking someone else's healthy stool and putting it into someone who no longer has a healthy stool. So this is in the same vein as probiotics, but again, that's a whole other conversation. And you read about it on the internet if it interests you.
No.
But I think our bodies, if we put the right combination of foods in our body, and we've talked about them, fiber, vegetables. A lot of people don't like vegetables. But we need to introduce vegetables to our children early so that they get in the habit. I'm so thankful and grateful that my mother put vegetables in front of us from the time I could walk. Because later in life, it will become a problem, because some people may not like oatmeal, or they may not like whole grain, and now there's, this craze around gluten.
Right.
Can you eat gluten? Should you eat gluten or not? And so on. A very small percentage of people are intolerant of gluten. But because it's a fad now, I think people are confused. But if you're someone who's taking gluten out of your diet, you don't like oatmeal, vegetables, fruits and vegetables, because that's where the fiber comes from. Apples are a great source of fiber. Peaches. So, say it again? Avocado is a source of what? So what is an avocado when you look at the nutrition content of an avocado?
It's more like a vegetable / fruit.
No,
But is it a carbohydrate, a protein, or a fat?
fat. It's a healthy fat for you.
It's a fat, yeah. So, and fats are really important too. We should not be afraid of fats, because there are 4 vitamins that actually need fat to be absorbed by the colon. So all these people talking about fat-free diets, or even low-fat diets, not smart. Because your body needs the fat to function. There are different kinds of fats. So that's where the label reading comes in, and figuring out if it's high saturated fat or if it's a very healthy fat. What are some healthy fats besides avocado? Okay, fish, nuts, almonds, walnuts, pistachios, macadamia nuts.
Let me
Yeah, go ahead.
ask you, peanuts, when it comes down to peanuts, is that a good source? Because some people say it can clog you up, so I'm not for sure. Is that a good source of protein and so forth?
So yes, peanuts. So peanuts get a bad rap and I think mostly for children, because peanuts, when they pick them out of the ground, sometimes they, the concern is that they have a fungus that's very difficult for children to handle. And the problem is with the media, health information on the internet, there's so much information out there that the information gets distorted, and then people don't really understand what to do. So an example of that is a woman who was speaking at a forum like this, many more people, and she says, very authoritatively, you shouldn't eat sugar because every time you eat sugar, your body shuts down for 5 hours. Or no, she said your immune system shuts down for 5 hours. Does that sound right?
No.
Why not?
I eat it all the time. My body shut down.
Huh?
I eat it all the time.
I eat it all the time. Well, but she's talking about your immune system. So how do you really know? Because your immune system isn't really something you can feel and touch every minute of the day, right? So this is how and I'll tell you whether or not that's true, but this is how information can get distorted, and this is what I think happens to the peanut story. I mean, my personal motto in all things is about moderation. So I wouldn't eat peanuts every day. Peanuts are very high in fat. They're also they've got more carbohydrates than most nuts. So I think it just depends on who you are, but eating peanuts, and I love peanut butter. So eating peanuts in and of itself is not necessarily a bad thing. Back to the sugar. Thanks. There was a study done many years ago, and this study was looking at the effect of sugar on the immune system. They gave table sugar, to rats, and then they watched what happened with the cell, because your immune system is made of a lot of cells that fight infection. So they're like the military, to fight off germs. And it's a combination of, so our military has 4 branches. So maybe there are multiple types of cells in the body that fight infections. But the most powerful one is what we call a macrophage. So they gave the sugar to the rats, and then they looked to see what happened to the macrophages after the rats ate the sugar. They noticed the macrophages, and maybe normally they move like this. They were sluggish, so maybe they're moving like this. And that effect lasted for 5 hours. So you see how the science was actually translated to, if you eat sugar, every time you eat sugar, your body shuts down for 5 hours. So that's why I'm telling you that story, because I want you, when you're reading health information on the internet or you're talking to someone, take a lot of it with a grain of salt. And if it doesn't pass your lab test or it sounds a little bizarre, then question whether or not it's 100% true. So there's some truth in what she was saying. There's a kernel of truth there, but it's not the full story. So that's similar to the peanuts. And you can probably pick almost anything around health now because there's so much conflicting information. And this is where it comes from, all these different studies that are being done and finding different results.
Right. Coffee.
So, yes ma'am, you have a question?
What about benefiber?
What about benefiber? So if you have trouble taking in fiber, food, in the form of fiber in the form of food, then I think there are perfectly good medicines and things you can buy over the counter to help with that.
Quick question.
Yes.
Yeah, my mother took laxatives every day. Is that good to take a laxative to move your colon every day?
No, it's not. And the reason is because, let me see if I can think of an example. I'll use myself as an example. I used to work out a lot, and then I stopped working out. And once I stopped working out, it was so hard for me to start working out again because the less you do, the less you want to do. Is that right?
Right.
Now think about that. Your body is supposed to be functioning in a certain way. And for some reason, whether it's temporary or not, you've got some constipation. So your colon has stopped functioning the way it's supposed to, and then you give it an aid, like a laxative, and it starts doing all that work for the colon. So now the colon's like, okay. And this is true. It's what happens. People who have laxative abuse develop diarrhea, and their colon just doesn't function anymore. It basically doesn't remember how to function because it's like exercising a muscle. What happens when you stop exercising your muscle? It atrophies. It starts to waste away because you're not using it. So it's the same idea with chronic laxative use. So when in a situation like that, the question always has to be, what is causing the malfunction? So in the case of the colon, if you're feeling constipated, and sometimes we are chronically constipated and we don't know. So if that happens, there are very simple things we can do to combat constipation, such as, primarily,
Water.
we are not drinking enough water, and I'm guilty of this too. It's hard to remember to drink throughout the day, but that is, I would say, exercise and drinking enough water are the two most critical things you can do to maintain a healthy colon motility. And then, of course, eating the high fiber diet. Collard greens. This is a leafy green vegetable. You can't go wrong with eating vegetables to help move things along in the colon. And the last thing I'll say about constipation is, if you're constipated long enough, the pain of constipation, has anybody ever had it?
Yes.
You're going to think you're dying. And we've had people come into the emergency rooms because they think they either have appendicitis or something catastrophic has happened. And it turns out they have fecal impaction because their colon has stopped moving because they're so constipated. And the stool is impacted, and it's painful. Or if you've had narcotics and you don't drink enough water, you don't eat enough fiber, you can easily get constipated because narcotics will slow down the movement of the colon, and constipation follows. So we can be constipated and not know it. But definitely, I would say, if you take one action from today, drink twice as much water than you're drinking now. Because it's really, really difficult to drink too much water. There is such a thing as water poisoning, but you have to drink so much water in a short period of time for there to be a problem. I wouldn't worry about it unless you know that you have some hormonal imbalance that will affect it. So I'm gonna stop there and see if you all have any questions, any more questions, or anything else you want to talk about with respect to the colon.
I'm gonna have to leave, but.
We're all
the thing
leaving.
I wanna find out about is, they always say when you should start your screening, but they never say what age you should stop it for colon cancer. Do they ever, because I don't know.
No, we generally don't. If you've had multiple colonoscopies that are fine, then they probably will lengthen the time for which you need another one. And that's generally how the cancer guidelines are written. So you can get one, let's just make up something and say you're supposed to get one every 3 years. And then you have 3 every 3 years, and they're all fine. They may say, okay, you don't have to come back for another 5 or 10 years.
If you live to be 90, you still have them?
Well, I think that's a personal decision. So if I'm 90, I don't think I'm going to the doctor ever for anything. But generally, guidelines are not written that way. These cancer screening guidelines are written to give people a benchmark to say, this is when you really need to start being vigilant for this thing. Yes, one more.
Can hemorrhoids cause colon cancer or anything?
No, hemorrhoids are not, the cancer causing lesion is polyps. And there are a lot of different types of polyps. There are a lot of different types of polyps, and that's why the colonoscopy or the colon cancer screening is so important. Because just from looking at the microscope, or looking through the microscope, or the tube they insert in the rectum, which, by the way, for those of you who haven't had it, it's as tall as me. It's long. But that helps them to see which kind are good versus bad. But generally, if they see a polyp, they'll snip it out and then send it to the lab just to make sure it's not a problem.
You make a person don't want to get it. You just have, when you talk like that, fear.
Yeah, well, so it's not necessarily about making people fearful, but I think it's an awesome responsibility to be given this body, right? What a blessing it is to have this body that basically operates like a well-oiled machine if you treat it the way you're supposed to. And so there's nothing to be fearful about. And I often use the analogy of a car. How many of you have a car you absolutely love? That's okay, you can raise your hand. It's all right.
You just got
We
your car.
treat our cars better than we treat our body. And why do we take that car in for service?
To get it fixed.
We take it in because we don't want anything, right, to keep it functioning. We don't want anything to happen to that car because we love that car. So we get the oil changed and the tires rotated and all of these things to maintain optimal functioning of the car. So think about your body in that way. That's why we're recommending all these screenings. It's not to say, oh, I'm trying to scare you, but to say, if you want to keep your body functioning, because you have to live in that body. It's the only one you get.
That's right.
So if you want to keep it functioning, this is just the maintenance that you're doing. And it's always better to know, especially when we're talking about cancer, it's always better to know early than to wait.
I have a question.
Yes, ma'am.
So, I know Kaiser has like a kit that they send out.
Mm-hmm.
Is that effective, or how do they know about the polyps if you're just doing the kit and sending it back in?
So I admit I have to do a bit more research on these tests. These tests have been recommended for a while, and I suspect it's because if you have cancer secretes some sort of chemical or something that can be picked up by this test. So I need to educate myself on that. But you know, the opinions are split about whether or not that's good enough. So if you have somebody in your family who's had colon cancer, I wouldn't rely specifically on that. I would get a colonoscopy until we have a better technology, which I hope is coming soon, because I think it's very burdensome right now to ask people to drink as much as we do, especially something that doesn't taste good. It makes people feel sick sometimes, but until then, it's the best we've got. And I think it probably does the best job of finding cancer early. But thanks for that, because I really do need to get comfortable to understand exactly what that test is looking for, because people have asked me that before. Mm-hmm.
So the virtual colonoscopy, is that able to detect what the other? Because I've never heard of a virtual before.
So, you know, the technology is moving so quickly, and it's improving all the time. I also need to look into this, but the challenge with not being able to see the lining of the inside of the colon. In fact, I wonder if this opens.